One of the first things my patients ask when I tell them they have chronic kidney disease is they ask, does this mean my kidneys will fail? Does this mean that I'll need dialysis? You know, a lot of people worry and wonder about chronic kidney disease. A lot of people have it as well. By the way, over 37 million people. We're going to talk about today exactly if having chronic kidney disease means that you will progress to dialysis or kidney failure. We're also going to talk, even more importantly, about the symptoms of chronic kidney disease. This is really important. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Okay, first thing you should know is that there are 5 stages of chronic kidney disease. By the way, I have a number of videos about chronic kidney disease, or CKD for short. I go into the stages in a different video, but there are 5 stages just so that you know. And this is the thing, the kidney is super important because, okay, what does it do? Well, it packs a lot of punch, let me tell you. The kidneys help filter blood. We need that to basically stay alive. That is super important. The kidneys also help balance our hormones, and it also helps balance salts and minerals, among other things. Kidneys are so clutch. They are so important. Now, when we have chronic kidney disease, it means that our kidneys are not working as optimally as they should. It means that there's some damage to the kidney that has occurred, and the kidneys are not filtering blood the way that they, again, should be doing ideally. Now, when we say chronic kidney disease, which is what we're talking about in this video, that means that the kidney damage or disease has happened over time, okay? So progressively over time, the kidney has been damaged. That's really important to keep in mind, and that's what we mean by the word chronic. It's generally happens slowly and over time. Now, this is the thing. Back to this idea of, if you have chronic kidney disease, are you going to progress to kidney failure? Are you going to end up on dialysis? Well, before I tell you the symptoms of chronic kidney disease, let me give you some good news. And the answer to that is most people, no. Most people will not progress to dialysis or frank kidney failure when they have CKD, chronic kidney disease, okay? That's important to keep in mind. It doesn't mean that this is not important, and again, that's a vast generalization, but if your doctor tells you have chronic kidney disease, CKD, it does not automatically mean that you're going to progress to kidney failure or dialysis, so please keep that in mind. All right, now, let's talk about symptoms. Now, this is the thing. A lot of times, and this is why I think talking about symptoms is very important, because in this case, it's almost like kind of like blood pressure. You know, my blood pressure videos, I've talked about how high blood pressure is almost, we call it like a silent killer, sort of like a silent disease, because most of the time, people with high blood pressure actually don't feel it. You may not feel it, you may not see it. And chronic kidney disease, for many people, and I would say probably most people, don't actually have symptoms. That's right. So this is the thing. You can have chronic kidney disease and feel just fine and not have specific symptoms that when you look in the mirror or what have you, you go to the bathroom, you do what you do, you get dressed. There may not be anything that really sort of jumps out and says, hey, you need to get your kidneys checked, okay? So that's the first thing. And remember, the thing is the kidneys, even when they're not optimally functioning, even with chronic kidney disease, they still often function well enough for us to go about our day. Thank goodness for that, right? But this is another reason why I need you to go to the doctor regularly. I need you to see your doctor even when you're not sick, because you need to have your blood and urine tests checked to see if you have chronic kidney disease or other conditions that can be picked up by blood and urine tests. All right, so now let's go on to symptoms. Now, I told you, most people with chronic kidney disease will not have symptoms, okay? So you may not even notice anything. However, as chronic kidney disease gets worse, we do often see symptoms. Swelling or edema can be a symptom that people have. And this often occurs because the kidneys are not getting rid of extra fluid and salt like they should be. In other words, the kidneys are not doing their job to sort of filter. But the thing is, as we go into even more advanced chronic kidney disease, as the kidney stages get worse, as the kidney damage gets worse, and again, I'm generalizing, I've got other videos again as on the stages, et cetera, et cetera. But as we get into advanced kidney disease, we can see things that people really can notice, things like fatigue, either increase or decrease in urination, loss of appetite, nausea, vomiting even can happen, shortness of breath, weight loss, having chest pain, dry skin, even sometimes itchy skin, and even things like muscle cramps. Not only that, but we can also notice other signs. We can notice that you might have or start developing anemia or decreased blood counts. You might end up with bone disease or malnutrition. There's other things. And again, those symptoms and those signs are often coming when the kidney disease is advanced. Remember, most people with chronic kidney disease will not progress to dialysis or frank kidney failure. Some will, that is the case. But remember as well that most people will not have signs and symptoms of chronic kidney disease either. And the symptoms we tend to see tend to happen in advanced or end-stage kidney disease. Now, the thing about it is you need to understand how your kidney is functioning and what kidney stage you're at, if you have chronic kidney disease or not. And if you have chronic kidney disease, what stage you're at. You need to know that, because once you know that, you can learn the things that you need to do to protect your kidneys. I've got videos on that too. But this is where you really work with your doctor, whether that's diet, exercise, medications, lifestyle, blood pressure, diabetes. I mean, there's a lot of things that we can do to protect our kidneys. That is where that really comes into play. But honestly, it comes into play in everyday life, whether you have chronic kidney disease or not, right? I want you to eat healthy and exercise and minimize alcohol and minimize medications that could harm the kidney, so long as it's okay by your doctor and what they recommend as well, right? Make sure you're keeping your diabetes and high blood pressure in check. Anyway, got plenty of other videos about that. But the point being is, understand that you may not have any symptoms of chronic kidney disease. So you need to make sure you get into your doctor to make sure you're getting your blood tests done, your urine tests done, so you can stay on top of these things. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me know what you think in the comments. Let me know if you have chronic kidney disease, if you know what stage. You don't have to divulge, but if you'd like to, please do. Let us know what you're going through, because sometimes what you write helps other people as well. Please subscribe to my channel, click the little bell for updates. As well, go to my website, drjencaudle.com. You can check out my blog, also sign up for my health newsletter, and check out other offerings that we have there. All right, guys, I'll talk to you soon.